I'd love to hear just from your experience how, first of all, you came on this journey of trying to like get to the bottom of issues that took almost 3 years for you to find, okay, I need a pelvic floor PT. I need to kind of find more answers, or I need another pelvic floor PT, or you're on your third pelvic floor PT, whatever it is. Tell me about your
Yes.
journey.
So I had twins in 2019, and having twins is a weird place to be and a weird, like, you connect with people that you never thought you would connect with before. And so I started following different twin channels on Instagram, actually. And then I came across Andrea, deliciously fit and healthy. And I came across her page, and she's a twin mom, and she was talking about having diastasis recti. And I'm like, I've never heard of this. Like, what is she talking about? Like, maybe this could be some of my issues that I'm having. So I watched her video on how to self diagnose. And so I did it at home. And I was like, oh, there's definitely something weird happening in my abdominal. Like, this is not right. This doesn't feel right. And so I did that at home. And then when I went to my next gynecologist visit, I asked her and I was like, hey, do I have this? Like, I don't know anything about this, but I saw this on Instagram, and do I have this? So she did a quick assessment, and she's like, yeah, you do, but you've done a good job closing it up for the most part on your own. And that was the extent of our conversation. That was it. There was no like, are you having any pelvic floor symptoms? There was no further assessment of the core. It was just, yep, you have this, but you've done a great job on your own. So keep doing what you're doing. And I just felt like, okay, all right, I guess I'll go back to Instagram again. And so I actually bought Andrea's diastasis recti course. And that was where I started, was with her. Her visuals and the things she said made so much sense to me. And she had been through it, but she was more on like the fitness and like nutrition side of things. And that was where she was coming from. But she had worked with pelvic floor PTs. And so she talked a lot about pelvic floor PTs. And I think that's how I came across a lot of the pelvic floor channels on Instagram that I follow. I came across Janelle, the vagina rehab doctor, the vagina whisperer, like all of these things. And I just was like, wow, I'm a woman and I knew nothing about this world. I didn't know this world existed. Pelvic floor PT, what is that? Like, as a kid growing up, my mom couldn't jump on the trampoline. There were things she couldn't do. She couldn't sneeze without like running to the bathroom. And I just like, that was normal. Like, she had kids, that was normal. No one talked about that stuff. It was just like, that's part of life. And so coming across these pages, I just kept learning more and more. And then finally, I found a search for someone who is in your area who is pelvic floor certified and has all the trainings and credentials. And I found a database and I looked for it and I found you. And I came across you. And that's when I started reaching out. I had an appointment at another practice that I went to, just a consultation to see what they had to say. But I was finding that like pelvic floor therapy felt out of reach financially. And I couldn't find anyone in network that I could see either who actually had the credentials that I felt like they needed in order to treat me effectively. And so that's when I came across you and I talked to you and we started working together. And I really felt like at that point, I got to like probably the strongest point I've ever been in my life. Like, I was able to do the pull up, and having those physical goals was like life changing for me. I felt so empowered and just like able to do things I never was able to do, because my ultimate goal was to keep up with my three kids. I just wanted to be active. When I got pregnant with the twins, I was probably in the best shape of my life. I was working out. I knew I wanted to get pregnant. I was trying to keep my body healthy. I really wanted an active pregnancy. And then I found out I had twins and that went down the drain. So I wasn't as active during pregnancy. But afterwards, I was like, I want to be active. I want to carry my kids and hike. When I had Leland and we moved to Colorado, I wasn't able to hike and carry Leland. I just didn't have that strength. I wasn't strong enough. I didn't have the upper body strength. That's always been an area of weakness of mine. And so I just wanted to be able to keep up with my kids and do things and go outside. And now there was two of them, and Cameron can't carry both of them all the time. And so I wanted to contribute. I wanted to have a kid on my back just like he did. And so I was able to do that to an extent. But I think doing all of those things before seeking out the pelvic therapy and really getting to the bottom of what was going on was probably my biggest mistake, because I wasn't healed enough. And I then spiraled into this place where I flared up so many muscles and aggravated so many nerves in my body that I was in pain a lot. Frequently, I was having headaches. I wasn't able to sleep. I was having all of these issues. And it was all stemming from not addressing the main stabilizers in my body. They were not doing what they were supposed to. They were not functioning well. They were not strong. And so all of these other pieces were trying to compensate. And then that's when I really I broke. I needed help. I didn't know what to do. I knew I wasn't doing something right, but I didn't know what it was. And that's why, when you came into my house and watched and could give me pointers, and you're like, if your lower back's hurting while you're doing this, then try to activate your core a little bit more. And then I could feel the difference. And I felt like I just needed someone to watch me and say, hey, you're not doing this right. Give me some feedback on how I could modify it based on my weak core and how I could keep moving forward. And it was a lot of trial and error. We had a lot of, let's try this. And then it would flare something up and we'd back off. And so when you moved, I was really sad. I was like, we worked together for so long and come so far. And then I was like, okay, Rebecca's gone. I feel like I'm in a good place though. Let me try a different workout program. And that's where another Instagram person comes in, Get Mom Strong. I started her workouts and I'm doing her workouts. I'm like, this is awesome. I feel so good. And then I had the worst, probably part of this journey. I started having hemorrhoids, and not hemorrhoids like I had had in the past. It was really uncomfortable. It bothered me. I couldn't function without creams and all of the things. And I just felt like I was losing my mind. I felt crazy. What is going on with me? And when I went to, again, my gynecologist checkup, I'm like, hey, I'm having this really bad problem. What are your thoughts? She checked. Yeah, hemorrhoids are normal after having kids. You might have some pelvic floor dysfunction, but I can send you to someone and have them check it out. So I was like, okay. So she sent me somewhere to an office, and I went there and was really disheartened because I knew from you and from Instagram that the care that I got in my initial evaluation visit with them was not acceptable for pelvic floor care. There was no internal exam. It was all external. I was encouraged to just seek out surgery. Even after stating my position that I was not willing to have surgery, that was an absolute last resort. I wanted to do everything in my power to avoid surgery. And so it was really not a good experience when I left the desk and they were like, would you like to make further appointments? I was like, I'll be in touch. And I walked out and called my husband and I said, nope, not going back there. Someone needs to shout from the rooftop, do not send women here. This is not pelvic floor care. This is not it. And so I felt good knowing that. But how many people go to that office and think they're receiving pelvic floor care and they're not? They're
Yeah.
not getting to the bottom. So it's been a really hard journey. So then I saw my primary doctor because I was like, well, maybe she'll know someone. So I went to my primary doctor and I wasn't sure what to expect. And I was really happy that she did a physical exam. She looked at everything and she was like, I told her about my experience at the other office and how it went and how I knew that that wasn't right. And she was like, I have a place that I've worked with and I've sent patients to, and they all have been happy. So let's try it out. She's like, message me if it doesn't work out. If it's not it, you message me and we'll find somewhere else. She was ready to hunt for someone with me.
Mm.
And so I called this place and it's oh gosh, I think it was in January, maybe, or maybe even December. I call this place and they can't get me in until February. And I'm like, months. And I'm like, how am I supposed to just continue living like this for months? And I'm an active person. I like to work out. It helps me. I stay at home with the three kids. Like, it helps me with my peace of mind and like being centered as a person. And so I'm like, what do I do? And all I could correlate it back to was starting the Get Mom Strong program. And I'm like, frustrated because I see all of these people who are like, this program's so great. And so many pelvic floor PTs recommend this program. I'm like, obviously I'm doing something wrong, but I need help. Like, who can help me? So I just felt stuck. So I stopped doing that program. And then I reached out to you to see like what your guidance was. Even though you had moved away, we still had a good working relationship. So that's when I contacted you and you're like, let's find you someone, like, let's work together. And then I was met with more barriers. I tried to connect with a doctor that's through a different hospital than my doctor and was met with, you need a referral from one of our doctors. So you would have to establish care with one of our doctors to come. And it's like, but you have these great physical therapists who are specialized in pelvic floor, but you're barricading me to having entry and access to this like such necessity thing. My insurance covers your office, but you won't see me because I have a doctor from a different hospital affiliation. And so that was frustrating. I felt really defeated. Like, where do I go from here? Like, this is so hard to get care from someone who knows what they're doing and all of the things. And so here I was waiting until February for this appointment, going, I don't even know if they're going to do it right. I don't know if I'm waiting until February and it's going to be a bust. But it wasn't, thankfully. I walked in, I had called them before and they said, oh, we don't typically do a pelvic floor exam on the first appointment. And, just get to know the doctor and then she'll go from there. And I was like, okay. So I walk in and I meet Audrey and she's like, we can do a pelvic floor exam right now if you want. And I'm like, yes, please. Like, I have three kids. This does not bother me at all. I just want to be better. Do what you got to do to tell me how to proceed from here. So I left there feeling really hopeful after that appointment because she knew what she was talking about. She did the pelvic floor exam. She's like, you have a very hypertonic pelvic floor. Like, we've got to get this to relax some. It's not good. Like, so I felt like we had somewhere to go from there. And it's been a constant like reevaluation. Pelvic floor problems are not solved overnight by any means. There's so many things and habits that have to be broken. So we're still working through it, but I'm finally in a place where I feel like I'm getting better.
Yeah. Well, actually, they're not solved overnight, but they don't occur
No,
overnight either, right?
no,
And what
yes,
what really like has taken me back with your story, because I could just like sit back and just hear all of the points of entry that we could have intervened earlier. But what we're not talking about, right, and what people really should hear is that you had a cesarean section with
yes,
twins.
yes,
And you were not referred to a pelvic floor or just physical therapist, just a physical therapist. If we just looked at the field of physical therapy, that's who you've been consulting with, in addition
right.
to primary care doctors, in addition to OBGYNs. So if we look at just the field of practitioners that you've just been engaging with, in actually addition to dentistry, we haven't even gone down that
Oh, yeah.
path. But if we just look at the fact that you had an open abdominal surgery,
Yeah,
right, that disrupted multiple systems, including your muscles that were completely separated. And if anyone has actually seen, there's on Baby Center an actual cesarean section that, I don't necessarily recommend that everyone watch if they're uncomfortable with that. But it's important for at least practitioners to see that that's a major open abdominal surgery. Muscles, nerves, blood vessels are being disrupted in a huge way. And you weren't referred to someone until you started to develop problems affecting a very personal, very intimate area of your life.
yeah.
And
I mean,
that's the problem that I have with everything that I'm doing now, Sarah, is to just highlight, was a pelvic floor therapist needed early on when internal exams would not have been appropriate but you probably could have been taught a lot about healing your body upstream before everything like went downstream and affected
Yeah.
hemorrhoids and pelvic floor pain and all of it.
My first child was 9 pounds and he was born vaginally. And honestly, that birth was probably easier on me than the C-section. And after having him, I didn't have nearly as many problems. I never noticed anything with my abs. I never had any issues that I was aware of at that point. But after the twins, like you said, I found it was an interesting experience. And I can look back on it and see ways definitely now that things could have been done differently, done better. Even just the twin aspect, everything I learned about twins was from books I read. And I can't remember the name of the book right now, but it's like twins, triplets, and multiples. And it just tells you all of these things about having twins, like gaining a certain amount of weight by a certain time in your pregnancy helps to reduce the likelihood of losing them, and so many things. And so most of the things I learned from that book. I didn't learn from my OBGYN. When I found out I was having twins, she's like, yeah, they're die. And I'm like, huh? Come again? What? They're what? You need to explain this to me. I'm twin illiterate. I don't know what that means. Like, die, is that? And she's like, oh, that's really good. That's the safest twin pregnancy you can possibly have. Like, that's really good. That means they're separated. They have their own placentas. And I'm like, oh. And then I get this book and I'm reading through all the different like modi and all the different scenarios you can have with twins. And I'm like, oh, that's what she was talking about. Like, that makes sense now. But that book was my guide. And the book does talk a little bit about C-section. But honestly, I had never had surgery before. And so going into the C-section, I was really nervous. I knew the whole time it was going to be a C-section because my baby A was breech. And so there was a very small chance that it wouldn't be a C-section. And he never moved and gave up baby A position to his sister. And he never flipped. He stayed. He's very persistent, even to this day. And so he just never moved. So I knew it was going to be a C-section. So I could prepare for that mentally my entire pregnancy. But I didn't know what to expect. And I was afraid. I had read all of these things about the higher chances of twin moms bleeding out, having issues during their C-section. I had seen people's stories on Instagram and it was scary. Like, I didn't want to educate myself too much. It was one of those, I want to know the bare minimum of what's going to happen and like understand, but I don't want to know too much because I will just really worry in that moment. And I wanted it to be a joyful time as well. Like, we were having these babies and I wanted it to be a positive thing. So going into the surgery, I was still nervous, but I felt comfortable because I had my doctor and I trusted her and I trusted I was in good hands. And the surgery went really smoothly. I mean, as smoothly as possible with 36-week-old babies, which sounds great, but in Colorado, it's not because it wasn't enough. I hadn't been here long enough to acclimate to the altitude for my children. So they were these big babies, 13 pounds of babies that I had, and they couldn't breathe. And so, there were those issues and stuff, but the C-section itself went super smoothly. The nurses raved about my doctor and how well she's able to stitch and everything. And, oh, your scar is going to be great. And there was talk about my scar and like, oh, she does the best job sewing up her patients and da 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 da. This is like so good. But there was never like, hey, you should massage your scar. You should touch it. Like, I was like, oh, kind of grossed out by it. Like, I don't want to touch that thing. Like, oh my gosh. And the tape they put on it at first, like, I don't want to even take that stuff off. Let it fall off. Like, I'm scared. I don't want to touch it. Like, there was no guidance though, like, oh, you should touch it. You should massage it so that it doesn't like adhere to the muscles underneath. None of that. No education around the scar and scar care or how painful it would be afterwards. We went in for the C-section. We knew the babies would go to the NICU right away. And so we didn't know what that looked like as far as my husband was there with me during the C-section and he got to see the babies right away. They only brought Ava over to me because Pax was having breathing difficulties. And so he was in a more triage state. And so they whisked both babies away right away. And Cameron had to go with them. And so then I was by myself. And I'm kind of glad I wasn't in the NICU room, I guess, though, too, because hearing from his perspective what it was like to be in that room, it was chaos and they were assessing them and just so much going on. But I went to a room for an hour, and that whole time I was really afraid because that's that key hour of like watching you for bleeding and things. And so I told the nurse how I felt, and she was really kind, stayed with me, talked to me, like didn't really leave my bedside for the hour that I was there before I got to see the twins. But we were planning for him to stay with the twins in the NICU. But that first night, I was in so much pain. And here I was trying to pump because I wanted to breastfeed them. So I'm trying to pump to jumpstart milk because I just had a C-section and my body doesn't know what's going on. And I knew how important that was from having my first. And so I'm trying to pump, but I can't get up and wash the parts. I can't even get up to go to the bathroom. Like I can hardly stand up. I remember barely being able to pull my legs to the side of the bed and then bear hugging Cameron to get out of bed to get to the bathroom. And I know that the nurses are there to help for that, but I felt like I wanted my husband, that's such a hard time. Like I wanted my husband to be the one who was there to be with me when it was scary, when it was hard. And he was torn between me and the twins. And so it was really it was a hard time. The first 24 hours was really hard, but it was just the more you can get upright and straighten your torso, the better your C-section is going to heal up and you're going to be in less pain sooner than later. So make sure you're moving around. And that was hard. That was nearly impossible. Like I could hardly walk. Cameron wheeled me in a wheelchair to the NICU every day in the middle of the night when we would be awake. At any point during the day, he was wheeling me in a wheelchair to the NICU and then standing over the isolates to look at the babies, let alone wanting to hold them. But I couldn't even pick them up by myself. He had to pick them up and put them on me. It was just, I did not know that side of a C-section was there. You see these people who like muster it up and they're holding their babies and everything, even post C-section. I had friends who had had C-sections and didn't tell me any of this. They were just like, my scar's tiny now. It's not bad. It's not bad at all. It goes smoothly. And, no one said how hard it was at the beginning, let alone like sitting. And I probably should have known my abs were separated at this point because I'm sitting in the bed and I'm literally watching my intestines in my stomach and I'm going, what is happening? Like I could see my intestines from looking at my stomach, and doctor's like, oh, that's normal, it'll close up some eventually, no big worries, like that's just if things moving through your bowels and your intestines. I'm like, this is just not right, this feels weird. But okay, if that's what you say. I didn't have the time or brain capacity to be like, let me go double check that this is right. Like I kind of have trusted my providers to do what is needed, if that makes sense. And maybe I should have looked a little bit. I know now I should look a little bit more. I should look a little closer when things are going awry or I feel like things aren't right. I should devote more time and attention to that. But when you're in the whirlwind of having twins, dealing with NICU, how long are I was able to stay in the hospital longer. Basically, as long as my insurance allowed, I was able to stay in that room and continue staying there until the twins eventually were released about a week later. But even that, like I had to go back to postpartum to have my meds, because if I missed my meds, I was in debilitating pain. And if I missed that window, I couldn't function. I would get into such an extreme amount of pain that I felt nauseous and I felt very dizzy. I made the mistake of doing that one day, and our oldest was actually coming for a visit that day. And I can remember looking at the clock and thinking the clock was like, the room was spinning. I was in such an immense amount of pain, but I was trying to mask it for his sake and not let him see me hurting and like me and worry about me, because there was just a lot going on for him. And so that was so hard. Like no one tells you about this though. It's not told. And it's really it's sad. And then you get sent home and I can't drive. And my oldest son is sick and he caught a cold. And so only one of us can go into the hospital at a time. And so here I am going in by myself, trying to make this connection so that I can get milk coming in, so that I can feed these babies. And I'm having to ask the nurse, can you please pick the babies up and put them on me? Because I can't do it. And here the nurse is assigned to not just my children, but multiple other children. And so it's like, it's such a hard juggling act in the beginning. And then you go home and you heal a little bit more and you think, okay, it's better. Like I can go back to normal, and years of just going back to normal creep up on you and your body can't sustain that. And that's where I ended up seeking you and seeking out more care for myself, is because I didn't know these things at the beginning, but how much time could I have saved? It's maddening. How much time could I have saved? How much healing could I have done if I knew from the beginning, hey, massage your C-section scar. Hey, let's do a pelvic floor assessment when you're this many weeks out. It's just, it wasn't there. That wasn't there. And I didn't know, after I had the twins, I noticed some tightness in my pelvic floor, like using tampons, things like that. I noticed some tightness. And I thought to myself, I didn't have these kids vaginally. Why is that there? Like, how does that even happen? Like, I'm so confused. And it wasn't until like learning and watching things and just being aware and doing my own research and going, wow, I never knew this. And so educating myself has been a huge game changer for me. But again, life is busy. You and I know this. And how many people have the time to really sit down and learn these things unless it's impacting their life to the point it impacted mine?
Right. And it impacted yours pretty soon. Just your description of how difficult it was to even swing your legs out of bed.
Yeah.
At that point, I'm thinking, why wasn't a physical therapist who works in a hospital, who sees people, Sarah, and don't get upset about this, but who sees people after gallbladder surgery? And we know
Yeah.
gallbladder surgery, we know how tiny those organs are. We know how
Yeah.
tiny those incisions are. And some of our therapists are preparing people with an abdominal binder so that they're not having pain when they're coughing or moving and getting out of bed. And just hearing your experience of having the added challenge of having to go down to the NICU and you couldn't walk there. You were
No.
actually like having to wheel out. So I'm even thinking, well, once you got home, how in the world did you get in the car and take your older son to his appointment when he was sick and do all these things? But no one took the time to actually prepare your body for more activity, not less. You actually
No,
were
not
more
less by
active.
any means. No,
Yeah,
yes.
you didn't go home to like recover after your surgery. You actually went home to
No.
do more.
Yes. And I had been on bed rest prior to having the C-section because I was having some preterm labor signs and I got the flu in at the end of January, and that kind of took me out of the game. Like I couldn't work anymore. I wasn't on strict bed rest, but I couldn't work. I had to keep my physical activity to a minimum. I was pretty much just laid up most of the time. So it wasn't like I was doing a lot right before having the C-section. I was not. I was really just resting and taking it easy and trying to keep the babies in as long as I could.
So now that you like have recapped kind of your whole journey from C-section, you even touched on having a vaginal delivery with a 9-pound baby that did not affect your body as drastically as having the C-section with twins. But now that you even added that component, I don't think I remembered that you were actually on some form of activity restriction. Now that you have kind of summed up that, what would you have like what would you have loved to know when you were in the hospital right after your cesarean section? What would you have loved to just have been taught or seen?
I wish that a therapist would have come in and done some education, like here's how to care for your body. There was, general like wound education on here's how to care for this wound, what to look for when you should come back if things are like, whoa, you've got problems. I think immediately after C-section, having a therapist come in, there was basic wound care of what to watch for infection and stuff, and what would be normal versus abnormal. But there was no like, here's what you should do in order to really regenerate some feeling there and take care of the scar. My scar is really big to this day. My friends who have scars that are like this, I'm like, I don't know how you did it, but my scar is like this. It's like a giant smiley face. I don't think it would have changed the size of the scar, but I can feel the layers when I am massaging my scar, knowing now that I should be massaging my scar and that it's not even too late now to massage it and to try to break up some of that scar tissue. I thought it was too late. And my physical therapist now is like, no, let me show you how to massage your scar. Let me show you how to loosen it up. And I'm like, what? Why wasn't that done immediately? And why did I have to wait 3 years for someone to tell me this? Someone should have told me this at the beginning and I would have started doing it. Like I would have found the time to start like doing it if it was going to help me heal better. And I knew the benefits of it then. And then even just having someone come in and say, hey, we know that your pelvic floor has been through a lot in the last 24 hours or however long it's been since the C-section, but you should seek out a consultation if you're noticing X, Y, and Z, or even just I guess, a consultation to just check in. Like you go back to the doctor after 6 weeks. I went back to the doctor. I was cleared. I was cleared for physical activity. Like, go do what you want. 6 weeks, but there was no like mention of pelvic floor care or like watch for these things. Your body just held 13 pounds of baby. Like that's a lot of, now me knowing what I know, that's a lot of pressure on the pelvic floor. And that's hard to maintain every single day, 24 hours a day. My pelvic floor is slinging these babies. And there was no like, maybe you should check out, pelvic floor therapy or at least have it assessed. Like there's nothing wrong with just going in, having an assessment done and someone saying either, yes, you would benefit or no, you're all clear. Your pelvic floor is in great shape because maybe some people have prepared. I also didn't know that I could have prepared before. Like I could have prepared when I was pregnant. I could have gotten education then. I didn't know that. What I really wish in an ideal world in my head, there would be a pelvic floor physical therapist in every OBGYN office that does a consultation with pregnant women. Hey, this is your education session. I want to talk to you about how you can prepare. And if you want to seek my services further and you want to work together, here's how we can work together in a physical therapy capacity or preventative care. In my opinion, I'm thinking that's where it really should have started, was during pregnancy. I should have been told, here's what you can do. And it's not even like it's huge workouts or huge things, but just knowing how to prepare those muscles, how to take care of your abdominals, all of those things could have been taught to me early on. It didn't have to wait until the C-section. But I guess in my head, worst case scenario, if we can't have a physical therapist in every OBGYN office educating, then there should be a consultation in the hospital that's part of your postpartum care at the minimum. To me, that should be the minimum. In an ideal world, I think it should be the office visit initially and then the follow-up in the hospital. So both pieces. And that's why I think I can see your mission and I understand now how much it could have benefited me then. But if you don't know, you don't know. Like, you just don't know. Not every woman is on Instagram searching out these things. Not every person feels this way. And, I've done a lot of reading, I've done a lot of understanding, and I view the woman's body so differently now. And we are doing such a disservice. And it's kind of gross. It has to change. It can't keep going this way. It's not sustainable. I told my mother last weekend, You need pelvic floor PT. Let me find you a pelvic floor therapist in your area. And I sent it over to her. I'm like, you need someone. This is not normal. You should not settle for this in your life. Like, we shouldn't settle. And I found my story to be even more isolating because people are out there talking about leakage and prolapse and all of these things, but they're not talking about prolapse in the anus. They're not talking about that part of it. Everyone is ashamed of that part of it. And so that made it harder for me because I felt like I was crazy. I didn't know, like, I felt deep down the pelvic floor could be the reason why, but I didn't know if I was seeking the right care at the time until I saw my primary. And she was like, no, absolutely. The two are related. So if a doctor is telling you they're not, which the first pelvic floor therapist I saw told me that that's really weird. I've never heard of the two being connected and made me feel even more isolated in my situation. So hadn't heard it directly until then. And you and I had talked about it. So you had validated it for me. But then I was seeing these people and not hearing about my issues. And I just felt alone. Like, okay, well, maybe it is something with me. This is what my life is destined to be, and it's not pelvic floor. So it's been hard.
Yeah, it sounds like it. It sounds like honestly that not every pelvic floor therapist is the same.
No, they're not
No,
created equally,
they're not
unfortunately.
created equally. Not every OBGYN is
No.
the same. I mean, it took you a while to really find that point of care provider that said, I'm going to go on this journey with you, and we're going to find someone who works if the first or the second or the third person I send you to don't. And for
Yes.
me, there's more mystery the longer we wait to treat something, because then it really does sound like, okay, it's going up to the jaw, it's going up to the head, it's going down to the pelvic floor, it's manifesting all these different symptoms. But yet, if we had not waited and provided you that care within the first 6 weeks and not just at 6 weeks tell you could do anything, because that's not
Yes.
realistic, your tissues aren't even healed
No.
by that point. It just sounds like it would have been less of a mystery had we started earlier. Had you been given information even before the surgery to prepare your body for what it was about to go through. And so
Yes.
now that we know that, and now that we know that there's so few pelvic floor therapists, if you can end and summarize this for me, Sarah, what would you want just any competent provider to know, whether it's an OBGYN, whether it's a therapist who's not a pelvic floor therapist, but someone who works in the hospital with other people after surgery? What would you want them to know just about cesarean section specifically from your standpoint, not a healthcare provider, but from your standpoint?
Just the amount of difficulty, the waves, especially you have a C-section, you've had this major surgery, but you've also just had a baby and your life has changed drastically. And I think as a mom, we want to be strong because we just had these babies or this baby, and we want time with that child. We want to be able to hold them. And so there's pain there, but we hold it together because we want that baby to be in our arms. And so I think C-section patients are probably overlooked a lot because, well, you're getting up, you're going to the NICU every day, you're making it down there, you're holding the baby, you've got this husband here or this support person here who's going to go home with you and help you. You're going to be okay. Like, you've got this, like I almost feel like we're discounted, if that makes sense, because it looks like we have all this support and all this care. And the reality was, my husband went back to work after 2 weeks. My babies were in the NICU for 11 days. So, how many days, you do the math, how many days was he at home with me after we came home? And that's where I think the huge, like, they're going to leave that hospital and go home, and they're going to be by themselves at some point. They're going to have to figure it out, especially even the first, my babies came home a day apart. So Ava came home first, and Pax was really struggling with feedings. And I can't imagine the job of a NICU nurse but I wanted him to stay at the hospital with Pax. I didn't want Pax to be alone. Ava had been there with him in the room all this time. And, I didn't want him to have a slide back in feeding and not be able to come home the next day because we were on the track to come home. And so I couldn't drive though. I wasn't supposed to lift things. I was still in my two weeks of don't no nos. And but I wanted my husband to stay with my son to make sure that he didn't slide back so he could come home and we could all be together finally. Because while a NICU stay of 11 days, in my opinion, sounds really small when I've seen such long NICU stays, a NICU stay is a NICU stay. And it's Groundhog Day for every parent, regardless of how many days it is. It's traumatizing for every parent, no matter how many days it is. And I feel discounted because we weren't there a whole lot. Like I discount our story because of that, I guess. But the bottom line is it's traumatic. So I was home with Leland and Ava by myself for 24 hours. And I also wanted to be there to bring my son home, but I couldn't drive. So I'm lifting this baby at home. I'm breaking the rules because what else am I supposed to do? Like, how bad can this really be for my body? I've got to do this. Like, this is what I've got to do. And oh, well, and so not being able to drive and all the things, Cameron came home the next morning, picked me up, and then we drove back to the hospital again to then bring Paxton home. And so I just think that sometimes the whole picture isn't looked at as to like what is the reality for this mom. Like there's not always a support system once they leave the hospital. There's not always those things. And so how can we really set them up for good care at home and taking care of themselves and learning, well, if you're going to have to go up the stairs, how can we teach you to do it in a functional way that's not going to hurt you? Like how can we work together? What are the barriers in your home? You're getting up in the middle of the night to pump and then washing all the pump parts and then putting bottles away. How can we talk to you about how to carry your body? And so I think that's my biggest takeaway is I think because we're not there just for a surgery where you have a surgery, you get care in the hospital, and then you go home. And typically, I would assume most surgeries are followed up with physical therapy anyways to repair muscles or whatever the surgery was for, whether it be shoulder, whatever, gallbladder. There's therapies afterwards that I think are probably given a little bit more specific attention. Whereas the C-section is, well, you came in, you had this baby. We're not going to bother you too much. We're going to send you home and then we'll see you in 6 weeks. And that's not enough. That's not enough. And I think moms look like it's enough because we just had this baby and we're going home and like we're carrying this bundle of joy. And it's like, oh, we don't want to disrupt those first 6 weeks of like bonding time and all of that. But the bottom line is a lot of us need something before those 6 weeks. Why would a woman with having a C-section not be seen the same? And it's like, because she's walking out with this baby. Like in my head, at least that's what I think. Like we put on this brave face because we just became a mom and we don't have to put on the brave face. Like stop that like stigma of you just became a mom, suck it up. You're a mom now. That's what moms do. Like that's not the way it's supposed to be. So I want that to stop. I want better for when Ava has a kid, if that's what she wants. I want things to change. The whole system. I just feel like the whole system is broken and it's sad. And I don't know how it gets fixed. Something's got to give, right?
I think this helps.
Yes. And that's why
this helps.
Totally believe in what you're doing. Like, yes. I told my physical therapist, I just like mentioned to her that you and I had talked and our conversation and stuff. And she just looked at me and she's like, that's a really good clinician. She called you and talked to you about the care she provided. She's like, that's a really good clinician. She's like, so she was like complimenting you, not knowing like, the whole story or anything like that. But she's like, that's not the norm, Sarah. And I was like, oh, I know. Like, I know this is not the norm. Like, but this was what we worked on together. And I just feel like, yes, we have connected over it. I just want to be a part of this. Like if I can help you and I'm not a doctor, Cameron's like, you should go back to school. And I'm like, I feel like that ship has sailed for me. I don't know. I have 3 kids. School's a lot.
Yeah, sir. I think, yeah, and this is a longer conversation, but your ability to share your story and help
Mhm.
someone else does not require additional education.
Yeah.
I'm going to tell you
And you
that flat
know,
out. From a doctor
yes.
who has more certification than she needs. I don't need as many. I do not need all these letters behind my name. You don't require additional education to probably make more impact than 85% of the doctors that are practicing today in women's health. You don't.
Yeah.
You really don't. And so more on that later, for
Okay.
sure. I'm going to respect your time and just thank you.
Okay.
And
Yes.
we'll
Yes, and
reconnect for
enjoy
sure.
your altitude and all of the things. We had such a good visit up there a couple weeks ago, so hopefully it's less windy for you because paddleboarding in the wind and waves was interesting. But
It feels amazing now. I'm going to enjoy it. And
good.
yeah, no, we'll reconnect again.